We will now embark on the development of a psychotherapy session template for interns. I know in the graduate programs that I completed, little was spoken about the structure of the psychotherapy session. However, I think it's important to have some format that one uses depending on the kind of clients one encounters. So we will now begin to look at the template that you developed of your own work. You've constructed an example of your psychotherapy session. Note the framework you use to include preparation for the session, beginning of the session, the work of the session that takes place, and the closing of the session. It is important as qualified supervisors that we assist and facilitate interns in developing their own psychotherapy professional use of self template. I will now offer my template that may be of help as you work with your interns. I suggest looking at your template and mine and extrapolating for your interns suggestions for how to approach the preparation for the session, beginning the session, the work of the session, and closure of the session. In the competency discussion at the beginning of our time with interns, we have the interns describe the type of setting in which they will work. For instance, a 30-minute session with clients who are seen irregularly will require a different approach than what I've shared regarding my template. Working with the interns to frame a session template is most important. As you view the series of videos, think about the parallel process. First, shown on the upper right side of the slide, we have the qualified supervisor and intern work with feedback-informed treatment and deliberate practice to master skills and meet competency levels. Second, on the upper left side of the slide, the intern and client participate in deliberate practice where the client practices new skills and ways of approaching issues and situations during therapy, then apply the new learning in daily life until the next session. In the close image in the empowerment phase, the client may choose to set an intention for a successful outcome and visualize what it will look like. This is what I call the parallel process, similar to the use of intuition by the intern in preparation for the session in the RISE image, where an intention for successful outcome of the session and visualization of the client's worldview are set. There are many types of psychotherapy sessions. For instance, I've developed a typology of practice settings to begin to look at the range of kinds of practice in which we engage. For instance, private practice, agency practice, community mental health, and healthcare settings. Note that the frequency and duration of sessions vary the reason for the sessions, homework, and combination of psychotherapy and case management services. This is not an exhaustive list and includes some of the common examples of practice. Therefore, some clients may be seen sporadically, and visualizing the client's worldview may be difficult before the session. I suggest that some form of preparation take place, as it will help locate the intern in the here and now while approaching the session. In this case, I suggest considering just a quick intention for a positive outcome at the least. I will now look at a typology of psychotherapy practice. There are at least three types or combinations of psychotherapy practice: individual, marriage, couples and family, and group work. The reason I suggest having the client use intuition when ending the session is to anchor the image of success in visual memory. In this case, the client may set an intention for success next week and then visualize the positive application of new skills. I've developed this parallel intuition process because I found that the power of visualization is an important component in success in reaching one's goals. By intending a positive outcome and visualizing the results, the client frames an image of what it might look like. By practicing visualization, the success one seeks becomes more likely. You will now use your own template, consider elements of my template, and discuss the context in which the intern works in order to assist the intern in developing a professional use of practice template. We will now move to the RISE portion of the psychotherapy session. Our focus in this session is on the antecedents to psychotherapy, or more specifically, preparation for the session. What we will discuss here is the routine an intern may use prior to entering psychotherapy with a client, reviewing progress toward treatment goals, Reviewing case notes and homework are the first tasks that a psychotherapist completes prior to beginning sessions. It is important to have prior and current knowledge of the client's trajectory before proceeding with sessions work. The use of intuition may involve the intern setting an intention for a positive outcome for the client and using imagination to step into the client's worldview. This is the beginning of the engagement with the client. Now we focus on preparation for the session. Again, review case notes, deliver practice skills, progress toward therapy goals, and homework. These are all important parts of the pre-session preparation for the work. In order to work appropriately with the client, it is necessary to have some notion of prior work and success this client has had in your experience. This information combined with engagement of the client at the beginning of the session is most important. Next, the intern may tune into personal intention, whereby the focus is on setting an intention for a positive outcome for the client resulting from the session, and to imagine stepping into the client's worldview. Opening pathways to one's knowing sense allows for holistically focusing on clients' body, mind, and spirit. Next, the intern will focus on engagement of the client, where one quickly scans and reviews key points of the review and intuition reflection, focuses on meeting with the client, and moves toward the session with the client. Engagement is the liminal bridge for the psychotherapy session. One welcomes the client and engages the client in the welcoming process, moving then to complete an outcome rating process like the outcome rating scale, where one explores at least 4 general areas. The outcome rating scale here has first looking at individually how the person has done during the past period of time and how interpersonal relationships have gone, and then exploring social kinds of engagement like work, social support networks, school, etc., and then an overall sense of well-being. These are kind of individual questions, however, they can move into discussions in more depth about the current situation in life. While listening to the client, the intern further is able to enter into the client's worldview, assess client's level of functioning since the last session and their here and now needs, and using the ORS discussion highlights to segue into a discussion of this week's work. We will now examine the various tasks that take place during the works stage of the psychotherapy session. Prior to discussing the structure of the works section of the psychotherapy session, I want to first consider the many tasks that may take place on the therapeutic stage. The typology of work tasks is not an exhaustive list, but captures many of the elements of what we do in the work stage of therapy. I've divided the tasks into 2 groups. Often you may find that there is an overlap between art and science, with some of the tasks falling within both areas. Under the artful professional use of self in practice, there is a carryover from the preparation for therapy and the beginning of the therapy session. For instance, the therapist continues to use common core factors, intuition, and boundaries. This table is in your notebook with an area for you to write further notes. Under the science listing, you will see a range of activities. Then there are the practice tasks, such as evidence-based practice methods and techniques of therapy, deliberate practice, feedback-informed treatment, trauma-informed care. I was looking at the literature about tasks in the working stage of therapy, and most of it focused on therapy methods and techniques, not on the structure of the therapy session itself. For instance, preparation for the session that takes place in the beginning phase of the session, the work stage of the session, and the closing. Next, we will consider the works structure of my current template. The list here is a brief overview of the structure of my working stage. First, we focus on the work to be addressed in the current session. Second, we engage in an overview of the current session. And third, the client will repeat practice of selected skills to be addressed in the session. Kinesthetic application. In this case, the person's practice embraces the whole person, body, mind, and spirit in the process. Finally, the intern and client synthesize the deliberate practice progress and other business that has taken place during the works stage. The work focus is a continuation of the introductory discussion that fuses the outcome rating scale concerns with discussion about the tasks that will take place. The client will share competence concerns, other ideas they wish to include today, and questions from the last week. It is here that the client will indicate if some form of crisis or other pressing concern needs to be addressed in this session. Next, the overview includes a discussion of where the intern may discuss client's progress towards competency and recommend additional changes to attain mastery of the skills of which the client is repeating practice. The intern may demonstrate the use of a skill that the client will demonstrate in the deliberate practice phase of the session. The client will discuss perceptual changes in competence and continue to practice. Note that from the typology of work tasks table, there may be other tasks that are included in a session. In this case, you would want to think ahead about time and how much time you will be able to devote to deliberate practice during the session. For example, you may need to engage in case discussion or evaluation of practice, as well as deliberate practice activities. Next, the deliberate practice tasks is where the client actively practices skills. Like an actor rehearsing the role that will be used in real-life experience, it is important to note that deliberate practice is a whole-person endeavor that uses all of the senses and learning pathways. Kinesthetic repetition is integral to the rehearsal of competency skill development. In a real sense, deliberate practice rehearsal is doing the client's use of self that is distinguished from being, that is about the multi-dimensional self and individual characteristics holistically, including body, mind, and spirit, with an awareness that the rehearsal is grounded in the here and now and non-ordinary reality. Often we may find that out of the practice emerges insights and synchronous experiences that assist in the therapeutic work. Finally, the intern and client synthesize deliberate practice progress with the other areas of focus during the session. It would be helpful to overview the non-deliberate practice activities of the session and then briefly synthesize the previous levels of skill development within the session's work. Review knowledge, skills, and abilities that were improved during the session, then anchor and fuse levels of competence that accentuate the current level of competence the client experiences. As we see, there are a myriad of tasks that take place during the work's session of psychotherapy. In addition to the tasks is the structure to the work section itself. At this point, we will move to the close of the psychotherapy session. The closing stage of the session is a time when the intern summarizes, fuses, and empowers the client to apply their work in daily encounters with others. The intern will consolidate the work of the session. This includes asking how the client will apply new skills by using the new deliberate practice self-acquired abilities in daily life. In this moment, the intern may want to affirm the client for the work that has been completed in the session. Next, the client and intern will list the skills practiced in the session today and discuss the client's feeling level about the work. The intern will focus on the positive results of deliberate practice skills that were acquired in the session. The intern will ask the client to give an example of a situation where the client may use the skill during the next week. Encourage the client to visualize a successful use of the skill. The session rating by the client is an important part of feedback-informed treatment for the intern. I use the session rating scale. There are 4 items or questions. It is helpful to record the scores of the session rating scale to track progress over time. With regard to the therapeutic relationship, did the client feel heard, understood, and respected? Did the client believe that you worked with what he or she wanted to work on and talk about today? And did the client believe the therapist approach is a good fit? Overall, was there something missing or was the session just about right? If you do not use the SRS, it is important to elicit the client's feedback. An important aspect of the therapeutic alliance is to include the client in therapeutic work and to allow the client to share feedback about the nature of the relationship from the client's point of view. Finally, empowering the client to go forward and experience success in using what was practiced today in the session is important. Again, encourage the client to use skills that were practiced, then ask the client to visualize using the skills and see how this feels. Next, we will ask the client to set an intention for a positive outcome and successful use of the skills this week. Finally, affirm the client for successful work and note that the client will have a good outcome. As I mentioned earlier, visualization is a powerful practice in aiming toward achieving goals. This concludes the discussion of my psychotherapy session template. Please use your template, other examples of which you were able to discover online or among people that you know, and my template to assist interns in developing their own psychotherapy session templates. Best wishes.